So your surgery will be like half an hour later?
Yes, about 12:30, 1 o'clock.
How do you feel?
I feel good. I'm excited. I'm a little bit tired because I haven't been able to sleep good, since I arrived. But in a way, it's kind of better because going into surgery tired means that when I wake up from surgery, I'll be doing a lot of sleeping.
Do you feel nervous?
Very little, not too much. I've done this before, so I was more nervous for the first surgery. Coming in this time, it's like anything in life. Once you do it the first time, it gets easier the second time. Hopefully this is the last time though. Well, the reason I came back to do a second surgery is because when I did my first surgery, I kind of was forced to finish early or earlier than I wanted to. The reason being is that I started having some issues back home, with business, with family, and a combination of that and just kind of running out of time too. So I was forced to stop a little bit early. So I was only able to attain 12 centimeters. My goal was 15. Because as I said on my first interview, my goal was to be 6'3", but maybe 6'4". So obviously being 187, puts me at around 6'2". So I'm at least 1 inch short of what I wanted to be. But now since I'm coming back again, it only makes sense to do 2 inches minimum, which will put me at 6'4". Yes, my family is behind me, mainly my wife. The rest of my family, they don't quite understand why I do what I do, but that's okay. I don't expect everyone to understand. But my wife is behind me 100%. She needs to be because when I leave home, she needs to take care of things over there for me. She was amazed. My kids were amazed, They think that I am already tall enough. They thought I was tall enough before I came the first time. But as I mentioned during my first interview, this is more of a family status, on my father's side, where, he was exactly my height now, 187, that's 6'2", but he had brothers, uncles of mine, they were between 6'3" and 6'5". So me being at the beginning or before the first surgery, being 5'9.5", 5'10", it was just never enough. I always fell short around them. When it comes to this type of surgery, as you know, it's something private. I don't tell everyone. Some people notice the height difference. Some people didn't notice or maybe just didn't want to say anything. Now keep in mind that before I did my first surgery, I was using what a lot of guys that feel short use, which is insoles, height increasing insoles, or elevator shoes, which is the ones that have the built-in insole. Therefore, I was around 6 feet tall anyways with those insoles. Being 5'10", you gain 2 inches, you're 6 feet tall. And now I'm 6'2", so only 2, in their eyes, they only see 2 inches. They don't see the 4 inches. So therefore, there was really no one that said anything,
Hello, how are you?
Hello, good morning.
Welcome.
Doctor. Thank you.
Are you ready?
Yes.
We're gonna take out your old nail for femur and we're gonna put fit bone. Fit bone nail really stronger than other internal nails, and also lengthening power. Cottons with electric power really much. So you are a big guy, your lengthening will be really safe. And also for tibia side, for dynamization, I will take out these 2 screws.
Carlos. Good luck. Bye-bye.
After the surgery first, how do you feel?
I feel good. I thought it was going to be worse, but I feel good.
I remember the first one kick, the quadrilateral.
Yes, I think it's easier today.
Yeah. This better or other?
Better.
Better. Alright. How's your pain?
Not too bad. After I move a little bit, it's not too bad. You know, the initial movement, it's hard.
Do you feel dizzy or something?
No, I'm good. This is Carlos from the USA. Here again for a second limb lengthening. This time I'm only doing femur fit bone, which is a new procedure they have here. The last time I was here, I did quadrilateral hybrid. What does that mean? That means that at that time, we were using Precise on the femur and LON on the tibia. I was able to accomplish 12 centimeters. I fell short of my goal by 3, and that's part of the reason why I'm here again. I'm not only going to do 3, I'm going to actually do 6, maybe 7. Thank you.
That's okay.